Dr. Berkun and Dr. Joseph, thank you so much for being with me. It's a pleasure to have you both here. Dr. Joseph, you're going to start to sort of set the table for us, if you will, and explain to us your organization and how many members you have and its reach.
Okay, yes. We represent the New York State Society of Anesthesiologists. It's a group of over 3,700 physician anesthesiologists who are interested in making sure that anesthesia care throughout New York State is being performed safely.
So your main concern, and the main reason that why you're here, as we've established, is that the nurse anesthetists are pushing for a scope of practice expansion. It's in the budget, and they have been trying for years to get this through the legislature, and they have failed. So now they're trying to circumvent the legislature, and apparently there's somebody in the executive branch that thinks that's a good idea, and you do not.
No, and that's why we're here. We're here to bring attention to the governor's proposal to completely eliminate physician supervision from nurse anesthetists. We have the highest standard of care, of anesthesia care in New York State. For over 30 years, our health department mandates physician supervision. And we're very worried that nurse anesthetists who are not as well trained and don't have the medical knowledge will be there alone. So the proposal is right now, the health statute mandates physician supervision. Anesthesia is very different from any other specialty. When an emergency happens, you have seconds to react. And it's very important to have a medical doctor who will make a medical decision on how to respond to that emergency.
So, okay, so when one of their arguments is, and I know that you're familiar with all of their arguments, but one of them is, well, there are shortages, and so therefore, if in fact we had the scope of practice, that we would be able to address some of these needs, particularly upstate. So what is your response to that?
Right. There is no shortage. There is absolutely no shortage. We have close to 4,000 physician anesthesiologists and a little over 1,200 nurse anesthetists. New York State has done a survey, and they determined that there is not one hospital that doesn't have physician anesthesiologists present there, okay, in the whole New York State. Furthermore, nurse anesthetists prefer to work in the major cities. And actually, American Medical Association last year conducted a survey and also published a study that says that 2/3 of nurse anesthetists, they actually work from Albany down. So if they really wanted to work in rural areas, they would be doing that right now. So their argument that there is a shortage is absolutely wrong.
So is there a concern, though, among your members that if in fact the scope of practice expanded, that there would be fewer jobs available for you?
Oh, no, we're in all different areas of the perioperative setting. I mean, we're there preoperatively, intraoperatively, postoperatively. We're in the critical care units. We're in the pain management clinics. So anesthesiologists really are needed throughout the institution. So there really isn't a shortage of work.
So is there an example then of other states have done this, right? The scope of practice exists in other states for nurse anesthetists, correct?
Well,
in a different way.
In a different way. So here is, just because some states opted out of Medicare requirement for physician supervision, but that's different from independent practice for nurse anesthetists. There are only really 4 states, and one of them, Oregon, actually says it's up to the hospital to decide whether nurses will work independently.
Okay.
So there are only several states that through legislation or regulation came up with independent practice.
So do we know if those states have had an experience in which unsafe practices have occurred, or emergencies of the sort that you mentioned, medical emergencies in which an individual who was a medical doctor needed to be present, was not present, and therefore a patient died or was harmed in some way? Has that been documented?
Well, those states are very rural, so it's very different practicing there from practicing in the state like New York. And when they choose to only have a nurse anesthetist, they are very careful in what surgeries they perform and how they select their patients.
But
However, there are several studies, and we're presenting those studies today at the hearing, that show that anesthesia is much safer when there is a physician supervising a nurse anesthetist.
Okay.
So there's a 50% decrease chance of having a mortality if the anesthesia care team is really led by a physician anesthesiologist, as opposed to having independent practice.
So do we know why all of a sudden this has appeared in the budget?
I think it's just a different way of getting independent practice and expanding the scope of practice. I mean, they've been trying for over 30 years to go through the legislature, but this is a different way of doing it, and I really think that the public needs to be aware that it's going to have a major impact, because they may enter into a hospital to have a procedure and not know if the person in charge of their anesthetic is a physician or is it a nurse.
You're entitled to ask that question, though, are you not, as a patient? You may not know to ask, but you could ask and get the answer.
Really, you may not know to ask. A lot of times people don't know who's taking care of them. They may see a coat, a white coat, or an outfit and say, oh, okay, it must be a physician. They're taking care of me.
Right.
And I think it really behooves us to inform the public that there is a difference potentially out there.
Our concern is patient safety. There is a big difference between physicians and nurses. We have our separate jobs. I couldn't do a nurse's work. It's very important. And if my OR nurse is not there, I wouldn't know what to do. We wouldn't start surgery. But at the same time, they can't do the work that we're trained to do. We have 4 years of bachelor's degree, 4 years of medical school, and 4 years of residency, which is up to 16,000 hours of training. We're also trained differently. We're trained to work independently and make medical decisions when emergencies happen. Nurses are trained differently. They're trained to work under a physician's supervision.
But are they asking specifically to do exactly the same thing as you are?
Yes. Essentially,
Right,
they want to perform the anesthetic independently.
Right.
Right now, they have to work either with a physician anesthesiologist or with another physician, like the operative surgeon.
Right.
But essentially, with this bill, they will be working independently. They would have a collaborative relationship where they may be able to speak to a physician over the phone, and even that is at most every 3 months. So you can imagine what could happen if you're on the operating room table and you're having difficulty breathing. Someone can just say, "Oh, okay, let me call up my collaborative physician who may be in another part of the state."
But if you're on the operating table under anesthesia, wouldn't a surgeon be present to perform the operation?
Correct,
Yes,
but
but
not-
the surgeon
but
is
not
not
the anesthetic.
responsible with this bill. They completely absolve the surgeon from any type of responsibility. Here's the problem. They're trying to expand the scope of practice to include areas they're not trained for. That includes, and if you read this bill, that includes preoperative assessment, which is you have to have a medical degree to do that, induction, which is very risky, emergence, which is just as risky, and pain management. They're not trained in pain management. Doctors are the ones who train nurse anesthetists.
So before we run out of time, I'm just curious, if in fact some of this language, such that you mentioned there, was altered, are you dead set against any possible expansion of scope of practice for the nurse anesthetists, any possible scope of practice, or is there room there for negotiation?
If they would like to practice medicine, they can go to medical school, do residency, and expand their scope of practice.
Well, we actually have a bill, in terms of safe anesthesia. It's called safe anesthesia care, where we define the scope of practice of the nurse anesthetist, and it's pretty clear in terms of saying that there's physician supervision, and we give them leeway in terms of what they're able to do in the perioperative setting, taking care of patients. So there is an option out there as opposed to this.
So, okay, just to be clear now, you are lobbying lawmakers. This is a different situation. You've been lobbying them in the past because you've been saying, don't pass this bill. Don't get this bill to the governor's desk. Now you're lobbying them to say, take it out of the governor's executive proposal. Don't put it in the final budget. Is that correct? That's where we are right now?
Exactly.
Okay. So you'll keep us appraised of how things are going, and we will see what happens in the final moments. Many things will change between now and then.
Yes, I can imagine.
I thank you so much for your time.
Thank you very much.